there was no formalized, robust, or comprehensive education in that for medical students, nursing students, midwifery. So you graduate, you get sent to a hospital, you go in there knowing that the hospital is full of germs and all kinds of things, but you don't have that specialized training on what it takes to protect yourself, protect your patients, and keep the environment safe. And so that was where we now saw a gap. And we said, okay, what can we do? So we entered facilities and we started working with them. Our scope is beyond Nigeria. We've been working in Nigeria alone, but of course we know that whatever happens in Nigeria affects the whole world. So Nigerians travel, diseases travel. And again, we're focused on, yes, the big ones, Ebola, Lassa, all those ones that make headline news, monkeypox or Mpox as it's called now. But we're also focused on the everyday infections that cause people to miss work, miss school, end up spending so much on medications and treatments. Many of us, even now, we've experienced this new malaria that is resistant. You take malaria meds, it's not going, you have to take another course, or you take antibiotics, it doesn't work, they give you another one. All of these little things that are happening to people around the country on a day to day basis, whether it makes headline news or not, that's what we're trying to prevent.
Thanks a lot. Thanks a lot. My next question for you, and I'm very conscious of the fact that we don't have a lot of time, so I'm trying to make the most of my 60 minutes.
Sure.
My next question for you, Niniola, is around. So I know this is not commerce, or this is not. There is no. If there is a minimal, commercial motivation in this is, like I said earlier, a passion project for you. But at times also, I know that as humans, we want to give our heart and our time and our attention to something that makes a real difference, right? And not just something whimsical or something along, and I'm wondering how when you started out, right? How were you able to kind of put some quantification to, to what you're about to get into, right? I know you're already in that space. You probably have some data. It would just be good for you to, shed some light on, how you figured out the real need, right, for infection prevention training, right? And of course, confirm that, Dr. Ada's, approach, would actually make a difference in the lives of people.
Yeah, so I think for us, again, like I said earlier, it took us about a year to decide what exactly we wanted to do. And that wasn't because we didn't have ideas. It's because we wanted to make sure that whatever we put our efforts towards would yield the greatest results. We wanted to be sure that we were actually solving a problem and not just creating another NGO, that exists to do what and what.
And we have a lot of them.
Sometimes, I think. So, yeah, so we really took our time. We did a lot of market research. We partnered with a consulting firm and we used data because ultimately it comes down to evidence. You can't think you know anything. You have to let the data guide you and show you what the reality is. We were not experts at the time on disease prevention in Nigeria. We had lived through a tragic experience and we wanted to turn that into something positive. And so really it took time for us to research and figure it out. But ultimately, it stemmed from the fact that this infection prevention and control training that healthcare workers don't have much of in Nigeria and across the world was what could have possibly saved my aunt and her team. They did what they could with what they had, but what we discovered is that there was no formalized, robust, or comprehensive education in that for medical students, nursing students, midwifery. So you graduate, you get sent to a hospital, you go in there knowing that the hospital is full of germs and all kinds of things, but you don't have that specialized training on what it takes to protect yourself, protect your patients, and keep the environment safe. And so that was where we now saw a gap. And we said, okay, what can we do? So we entered facilities and we started working with them. We started working with the University of Lagos and other partners to develop curricula, courses, diplomas that healthcare workers can now become officially, properly trained and certified in this field. That we realized was not enough because that works when people end up in the hospital. Now they can get safe care from these trained health workers. But what about people who stay in the communities? We know that many Nigerians don't seek care when they're sick. We resort to traditional herbal medicine, other things, maybe local chemists, and drug sellers in our communities. And so we had to go into the communities as well. We used the youth as an initial bridge through the schools, and then we entered the communities themselves. And like I said, we've been working with many community influencers and community members across different LGAs in the country to equip them to also be guardians of health and also be disease detectives, so that when something does go wrong, it doesn't spread fast and it can be quickly treated.
That's very helpful. Thanks a lot for sharing that, Niniola. So, just thinking through some of the things that we've discussed, it looks to me like so. And correct me if I'm wrong. It looks to me like there are three major interventions, right? That I think I can understand from what you shared. So, number one is the training of health workers who work within hospitals and educating them on how to manage some of these things or handle, you know, this kind of things. And number two is, like what you do with the community, right? The 96,000 people, right? And then the third intervention is more like on the policy formulation and curriculum development kind of thing, right? Will that be a good summary of, your like a three-prong approach to disease prevention?
Yeah, absolutely. Those are the core places where we work: government, communities, and health
Mm.
facilities. That's where you'll find us. Because again, we've seen that that is where systems need to change. That's where things really, if we can get it right in those three locations, then comprehensively we now start to see a difference.
Very clear. Now, a follow-up question on that, Nina, would be that if you look at these three interventions,
Mm.
right, which would you say is making the most impact today, right, and really delivering on on the promise of disease prevention and all of that, and that you probably need to scale up?
It's hard to pick, and I'll tell you why. Because again, in our
Mm.
experience over doing this for 10 years, we've realized that none of them can work in isolation. Policies have to be there. The government piece has to be there because that is what sets the tone, sets the standards, makes sure there's accountability, which is a very important thing in healthcare. If nobody is accountable, nothing will ever work, right? So that has to be there. But you can't have policies and accountability only in health facilities, hospitals, and clinics because of the community element, which is where everything starts. People fall sick in their homes. And what we want is for every Nigerian to be able to access and trust their local health facility enough to go and seek quality care rather than staying at home like we see often, hiding or treating, self medicating, and complicating the matter up until when it's almost an emergency and then seeking professional care. And so for us, those three things, we can't separate them. It's hard to say which is the most effective. They're all effective. For example, in our health worker training programs, we've seen that the average change in knowledge score jumps from about 46% to 85% after they go through our programs. So you can see that that alone is a huge, difference because we're equipping them and building competencies that they've never had before. For the average person in the community, it's the same thing because we're teaching them and equipping them to play a role that they've never done before. And the policies are also extremely important and effective, like I said, because that creates the system and the enabling environment for all of these things to work. And so it's hard for me to pick one, to be honest. And I will say that before this stage of Drasa, before we got to this 10-year mark, we were doing a lot of other things. But we've streamlined to just these three because these are the most important and most crucial things that we believe investing in and scaling up will change, on a national level and even internationally.
All right, so I agree.
It's hard.
It will be difficult. Yeah, it's hard. I totally get it, and thanks for being, like on point on that, right? Because some other guys will try to say maybe this, maybe that, but you're like, no, it's
Yeah.
difficult, and I appreciate that. Um, Now, my next question, if you don't mind me going off script a
Sure.
little bit, right? Don't worry, I'm not going to put you on the
It's
spot.
fine.
My next question is around. So you mentioned something around, you're trying to build a community of people that have trust in the primary health systems available within their respective localities. And I couldn't help wondering, is that trust already earned? Is it that we have things or system or infrastructure, right, within the local space that they are not aware of that they can leverage, right? Because the last time I checked, the local primary health centers and the local public health systems within the local government are not always very
Yeah.
good,
Yeah.
right? So if we're telling people to trust that, is that trust earned? That's my first question. Now, my follow up question on that will be around, uh, you know, something I look at you and your passion is, infectious, right? Allow my allow my play
Yes.
on words,
Yes.
right? Your passion is yes, it's infectious, is gets across and all that. And I'm wondering if that is a factor in being able to recruit these community players, 96,000 people and growing, right? Who have now become like a part of your army, so
Yeah.
to say, fighting diseases. How are you able to do that? Is it your passion? Is this, I'll be delighted to hear how you go
Yeah.
about this,
Yeah.
please. I hope those questions are
Sure, yeah,
clear.
absolutely. So the first one, you're right. There are huge challenges when it comes to primary healthcare in Nigeria. What we are lucky right now, our current minister was the former leader of the National Primary Healthcare Development Agency. He's passionate about primary healthcare and he understands why we have to get it right. We have seen it work very well in Nigeria's history if we go back in time to the days of Rapsam Kuti. But now it is broken, if we're being quite honest, and it's not functional. So when I say building trust in the system, it's also setting expectations and letting people understand that yes, there are challenges. Yes, your local health facility may not be the most robust in terms of what they can offer you, but plugging into the system is step one of you protecting yourself and your family members, your household, your neighbors, so on and so forth, from what could end up being, a tragedy. And so getting them to understand that these health workers are suffering as much as you. They want to work in a facility that has all the equipment and gadgets and all that. We are all dealing with what we have on ground and trying to make the most of it. And so getting them to see their roles as these health champions, as we call them, see their roles as encouraging neighbors to seek help is really, we've seen it work. We've seen this. I mean, I can give many stories. There's a story of a lady who is a hairdresser in a local government in Lagos State, and she noticed that one of her neighbors was coughing. She suspected tuberculosis because of the training she had gotten through us. She confronted him and he immediately said, no, typical reaction, God forbid, I'm fine, this and that, I'm going to drink this thing, there's no problem, all of that. Long story short, she kept insisting. And she eventually got him to speak to the local health authorities on the phone, not going anywhere, just on the phone. And after having conversations and all of that, they built a relationship and trust. And he himself went to the local health facility, got diagnosed, and indeed he did have tuberculosis. So think about if that man had continued walking around in his community, talking, engaging, going to work, coming home, the impact and the spread, because this was an urban slum community at the time, what would that have ended up? How many other people would have been affected because of his lack of trust in the system? So when I say building trust, this is a kind of example of what I'm talking about. It's not perfect, but we're trying to start the process while relying, of course, on the government to fix some of the more infrastructural and issues that are bigger than what DRASA can do. And then your second question around how my passion, infectious passion, as you called it, has helped us to achieve what we've done, especially with a network of 96,000. It's not me. I have to say, it's really not. I have and I've always had, as leader of this organization, an amazing team behind me. People have come, people have gone, but I have an amazing team of people who are all equally passionate, and I wish you could meet some of them as well. And together, we're the ones that have done, this work. We work very, very closely with the government, which was hard because in the beginning, as a family, we were not happy with the government and with the way things happened during Ebola. But we soon realized that we have to overcome the tragedy and the pain and use government as the number one strategic partner we have as for this organization to get things done. And that has helped immensely. Working through government structures, because I can't go to a community in Sokoto and tell you who the local influencer is. I don't know. So we work with people who are on the ground, including government officials and authorities, to help us achieve the goals that we have, including recruitment, training of these health champions across the country.
Hey, thanks a lot for taking the time to watch the podcast. We are super thankful for you taking that time and investing the time to learn. We hope that you find the story inspiring, and beyond that, that you've been able to articulate one or two things that you want to do differently in your own entrepreneurial journey. May I encourage you to please like, subscribe, comment, and please share the word within your own circle of influence, especially within those that you think are on the same entrepreneurial journey with you. May I also encourage you to please, beyond subscribing to our YouTube channel, follow us on our other social media platforms. That means a lot to us, and we can see that that helps us to track that we're making some progress and so making some impact. Thanks a lot once again for taking the time to watch, and we'll see you on the next episode.